My friend, hello. Today I'm going to tell you the whole truth, which unfortunately many of my colleagues often don't talk about when it comes to penis enlargement. If you watch this episode until the end, you'll find out what methods exist, how effective they are, and you'll understand for yourself whether it's worth doing or not. Why? I created this episode to discuss it, not the complex surgeries I've performed. Because of the group of people who started reaching out to me after those interviews I gave, and it turned out there were a lot of them. And I noticed that all these people, either before or after seeing me, also go to other specialists. And what they are promised, what they are told, really bothered me. And so that you know the truth, so that you know what you will get from the surgery and what complications might occur, I made this episode to present the unembellished truth about everything as it truly is. If you watch it, you will definitely be able to decide whether you need this surgery or not. The format of today's conversation will be like a talk with a friend, because each of you is not a stranger to me. Actually, a person is someone I want to help, someone I want to help figure out their situation. Many of you come to the appointment and, as if in a restaurant, say, I need 4 centimeters, I need 5 centimeters, and I need 8 centimeters. Actually, that's the truth. This is something nobody tells you. The result depends very little on the surgeon. Yeah, that's the first thing. Second, the complexity of the operation. The operation itself is actually not complicated at all. It's more delicate, but it's done very quickly. If the surgeon is exaggerating the seriousness of the operation, that's not true. Are there typically any complications with this type of surgery? Yes, there are. It happens. If it's really done by unskilled hands, then it's possible to damage the penis, and there can be a complete loss of sensation in the penis. What should you know about the results? This means that by agreeing to this surgery, you should be prepared to not get any results at all. Not many people will tell you this, but the patients who come to me can confirm that many of them. We initially agree that in this case it might turn out that nothing will come of it. After 6 months of using the extender and having surgery, we may only gain half a centimeter in the end. Is it worth it? If it's worth it to you, at least you should understand what you're agreeing to such a long rehabilitation for, and such a long period of wearing an uncomfortable device. So today let's look at what methods of penis enlargement exist in general. Let's start with the simplest, fillers. Let's imagine that my hand is a penis. The principle is the same, the skin and the tissues that lie under the skin. The main principles of enlargement using fillers, which have become so popular now, involve injecting them into the subcutaneous layer. The penis, the only difference from the hand is that there is no fat layer there. That is, the skin is movable, unlike on the hand. It's crucial to know this because if the gel is injected improperly, it can migrate significantly and move around. There are 2 types of injectable gel. The first type is the same as what women get for lip injections. As many people say, Botox. No, it's not Botox, it's hyaluronic acid. Botox is what turns off the muscles. And exactly the same hyaluronic acid, but patented for use on the entire penis, can be injected. It's injected subcutaneously, filling it evenly. That is, imagine if we inject it subcutaneously into my entire arm. By the way, I've met many such patients in the army. They inject not only into the penis, but also inject paraffin into the areas around the bones. The same kind of subcutaneous filler injections are also used to increase the thickness of the penis. What's important to know? If you want to get a more or less good cosmetic result when enlarging the shaft with hyaluronic acid, I recommend doing this only for those who are circumcised, or to get circumcised first. If you are not circumcised, it won't look very aesthetically pleasing. That's why the first step should be circumcision, and only then proceed further. Then you can experiment with fillers. And how long do these fillers last? A month to a year? It's all very individual. If you haven't tried it before, if you don't have experience using fillers, you don't know how active your enzyme system is. Hyaluronic acid products are advantageous as they get absorbed, but this also serves as their disadvantage. If you're not satisfied with the result, the product will dissolve and you won't have any traces left. That's a plus. But if you're happy with the result, the product will still dissolve, and on the contrary, you'll lose what you basically paid for. 80%, by the way, of the procedure's cost, even I'd say 90%, is the cost of the filler itself.
How long does it take to dissolve?
The cost of the filler, the time it takes to dissolve, all of that is individual. Let me explain why it's so complicated. A good filler, approximately 2 milliliters, typically costs around 20 to 30,000 rubles. The first augmentation, by the way, is actually the most expensive. It can cost about 1,200 to 1,300.
And how long does it last?
The procedure done under local anesthesia takes 15-20 minutes. The entire cost is for the filler itself.
And when does it dissolve?
It's individual. For example, if I do it, it might dissolve in a month, but for my neighbor, If he does it, it might last for 6 months or even a year. It's individual, but a very important point is that if you're suddenly unhappy with some result and you belong to the group of people for whom it dissolves slowly, medications containing the enzyme hyaluronidase can be used to enhance your body's enzymatic system. Suppositories with specific dosages can speed up the process. Or you can even get a local injection, and where the injection is given, the gel will dissolve. By the way, the gel is used not only for penis enlargement, but we also use it for intimate plastic surgery. We inject around the glands itself, and we also give an injection into the frenulum. And for those patients who are helped by therapies for premature ejaculation, therapies like contraceptives and local anesthetics help them. This method is very effective in prolonging intercourse. That is the first time you do the procedure. That's when you'll understand how much your body likes or dislikes this medication and how long it lasts for you. Are there any allergic reactions to hyaluronidase? There are almost no allergic reactions or intolerances, but are there any complications? Infections can occur, but are usually easily managed with antibacterial medications. As you know, girls get injections in their lips, faces, and even more intimate places than their genitals, because the genitals we don't show to everyone but the face, and the bad result will be visible to everyone. And while you walk around, while it dissolves, all of this won't look very nice. Why is the first procedure always the most expensive? It's very simple because maintaining it requires less product. That is, during the first procedure, you are essentially injecting it. That's 10, 12, 15, 20 milliliters. It all depends on the amount of product and your starting point. If the penis is small, you need less product. If the penis is large, you need more product. Are there any alternatives to hyaluronic acid that you can inject and forget about forever? Yes, there are. Should you use them? No, definitely not. That's exactly the point. They can cause very bad consequences. This includes suppuration, inflammation, rejection, and migration. If hyaluronic acid has migrated, and it can happen because, unlike lips, you will be actively using your penis. If migration occurs, it is possible. No matter what anyone promises you, it can migrate to the pubic area, it can migrate to the scrotum, or on the contrary, it can clump up near the head. That is, in the case of hyaluronic acid, it's easy to fix, but if it's a permanent filler that you've used, it will stay with you forever as a synthetic material. Unfortunately, except for surgical intervention, and even then with poor cosmetic results, there's no way to fix this. So if you want to increase the thickness of your penis, either the glans or the shaft, the first step is probably hyaluronic acid.
Those who do this are usually satisfied. Sensitive people sometimes say it wasn't worth it, but overall it's not for nothing.
I generally don't try to influence people's decisions about fillers. If someone has made up their mind, they just need guidance on the process. When it comes to enlargement, I often try to dissuade people. It's something that can't be undone or reversed. You get a filler, you're unsatisfied, it dissolves, and then you're happy.
What percentage of people after the first time say, "That's it, I'm satisfied, thank you, I won't do it again," and what percentage continue?
If we're talking about premature ejaculation, then among those who do this to prolong intercourse and it helps them, about 70 to 80% come back. Those who do it to increase the shaft or the head of the penis, about 30, maybe 20 to 30% come back. They check a box for themselves. They tried it, understood it, and either liked it or not. And many of them don't come back. We talk to such patients and they came for other reasons. They say, "I just tried it, I was curious." So they satisfied their curiosity, realized that there was basically no difference whether before or after. It was more for themselves, really. A psychological component is closed. Or let's say the wife gave birth and her vagina became wider. Well, she doesn't want that. There are surgeries that can make the vagina narrower. We tried it but found no difference, so we stopped. Some people are satisfied though, honestly, most do it. We call it a bathhouse penis. It's for when you're in the locker room, in the sauna, in the bathhouse with your friends, so you don't feel embarrassed. You come in there and, your penis is actually normal and you realize that it's really just a psychological issue. Well, he wants to do it. It's just easier for him that way. You know, like how people get veneers. Not everyone gets veneers because something drastic is going to change in their life. They get them because they want to, because that's what they need. If you want to do it, ensure it's done in sterile, reputable clinics under proper conditions. Don't compromise on quality to save money. It's safe when done right. The most important thing is don't try to save money on the materials and don't get it done by someone unqualified, because you might end up with bigger problems. It's better to refuse altogether or do it well and pay more. Now I'll tell you whether the extender works and, in general, how effective it is, so give a like and watch the video. If you look at the meaning of the word, it's an extender, in essence, an extender for the penis. So where did it originally come from? Remember some tribes in Africa, and you've seen that they wear rings on their necks? That is, they stretch what seems to be an unstretchable, inextensible organ where there is bone. And they stretch it to such an extent that without the rings, the head can no longer be held up, and you can even get a fracture or dislocation if you remove the rings. I think I could be mistaken or wrong, although I'm not sure. There was a legend that if a wife cheated on her husband, he would remove her rings, causing her death. Well, maybe it's just a fairy tale, but that's how it originally sounded. In these same tribes, men have been stretching their penises since ancient times. They even wore a special pouch on their belt, where they would place their penis, which they had stretched, coiling it up like a snake. It's so strange. Yeah, they stretch it out quite a bit there. Another issue is that it already wasn't working because all the necessary elements, vessels, valves, venous parts, were also stretching and stopped functioning properly. There's a reasonable length that can be stretched, and in general, does an extender even work? It works, but honestly, in reality, most extenders won't help many of you without surgery. Because unfortunately for many of you, the penis is very dense, the tunica albuginea is quite dense, and the tension that the extender provides won't be enough for all of you to get results. So if you wear an extender, it's a device that pulls your penis by the glands, and there are different variations, some that tighten around the glands and some that use suction on the glands. But the point is the amount of tension, the degree of fixation you can achieve, and the amount of time you can wear it all matter. Unfortunately, for most of you, it won't give any results. Not because it's a scam, not because it doesn't work, it actually does work. Unfortunately, you need to put in much more effort and wear it for much longer. You can't wear it at night because you're asleep and you don't realize it. Sometimes you wake up at night with your arm completely numb. You may even wake up by chance to find your arm just hanging there, unable to feel it at all. The same thing can happen with your penis. It can happen that you put a suction cup on the head of your penis, fall asleep, and by morning, when you wake up, the whole head is covered in blisters. At best, there could be a thrombosis present. That's what's dangerous about all these devices that work by suction. The blood stagnates in the head, and this can provoke thrombosis. If you're on a course, have thick blood, or are prone to thrombosis, there's a risk of developing thrombophlebitis. So some vein, I think, could just get a clot, a clot forms inside the vein, and there will be local inflammation. It's not really critical in terms of life and death. It's not like a clot in your leg, but it can still cause discomfort a lot. And sometimes there are blisters. You overdid it with wearing blisters. They appeared, and you can't wear them anymore. That's why you need to measure precisely here. But again, for most people who will wear the extender without surgery, at least the chances that the penis will increase are minimal, because the tissue is too dense and the force with which the extender pulls is not enough. There are also surgical methods, actually. They are not common here. They involve thickening the shaft. Degloving is performed, that is, the skin is removed from the penis downward and a silicone implant is placed on the shaft of the penis, and then the skin is put back on. So it's basically the same principle as with breast implants, for example, but here it's not very aesthetically pleasing, not very comfortable, because unlike the breast, this organ has a completely different functional significance. I don't recommend doing such things. It looks very unattractive. Honestly, the penis looks like a hot dog, a thin head and a thick shaft. And during an erection, the shaft increases in size, but the implant stays the same size. It ends up looking like your penis was hammered in place with a local hammer. When it comes to penile surgery, think it over 10 times before deciding. The main surgery performed for penis enlargement is called ligamentotomy. Why is it called that? In Latin, this translates to cutting a ligament. Here I have a visual illustration like this. And here you see, this is the pubic bone, this is the penis, and here between the pubic bone and the penis there is a ligamentous apparatus. This is the very ligament that we need to cut. The core of the operation is to cut carefully and skillfully. Many surgeons. What likely sets me apart is that while others stimulate via the pubic region, I utilize a device to approach from underneath. This is better for the patient because the scar is smaller and almost invisible, leading to better healing. However, the pause will still be visible even with the device. You've all seen an incision like this on the hand. It's called raphe. A raphe is a suture made along a seam. Once healed, it becomes invisible. The point of cutting this ligament is that we don't actually enlarge the penis, but we allow more of it to come out, because up to 40% of the penis is hidden inside. And if your anatomy allows it, and if you have a large ligament, if your penis is configured in such a way that your erection points upward, then you have a better chance, meaning your penis stands. There is a chance that after ligamentotomy it will become bigger or smaller. There are 2 points. First, what you get right on the table. Often on the table we can get ½ a centimeter, sometimes even 1.5 centimeters. It's nothing for you, everyone has it like 2 or 3. Yeah, nothing changes on the table. After the surgery, wearing an extender is essential, as the procedure is pointless without it. If the penis isn't pulled down with the help of an extender, which will pull it toward the left knee, there's a temporary type of extender like that. It's worn for the first month, sometimes even 2 in the morning and evening for sure, and you also have to make sure to watch how it's healing. That is, because you simply cut the ligament and all of this can reattach itself, that's exactly why you need the extender, to pull the penis downward so it doesn't reattach back. Klopkov. Otherwise, you may end up with the same issue or even scar tissue, potentially worsening the original condition. That's why it's not enough to just have the surgery and be done with it. You're looking at 3, 4, maybe even 6 months of wearing it. An extender, definitely. By the way, this is a very important point. Why should you try wearing an extender before the surgery? Yeah, there are such patients, thank God I learned from someone else's experience, who came to my colleagues for surgery, had the surgery, but couldn't wear the extender. They have such a sensitive glans that after literally 30 or 40 minutes of wearing the extender, they experience severe irritation. And the level of discomfort was so unbearable that they simply couldn't wear it. That's why it's important to wear it for at least a week or a week and a half before the surgery. The first, learn how to use it properly, that's one. And second, make sure you can do it for a long time and regularly, and only then come to this surgery. If you don't pull the penis down, it will reattach back to the pubic bone. This is the first point. Second, look right here where the ligament ends, the penis begins, which we are pulling out. When wearing the extender, you stretch from the base to the tip, stretching the tunica albuginea. This is what is stretched during a ligamentotomy. Even if your penis stays the same length, you increase the part of the penis that you stretch, because nothing is fixing it here, and you cut this ligament. If there are additional ones, then the stretching zone starts from here. It's kind of like, well, if I give you a rubber band right now, made from the same material, just me. In one case, it's the same length of rubber band, but someone is pulling it for you, and I'm keeping half of it in my fist. In another case, I pull 2/3 of the rubber band out. Of course, you'll pull out the one that's less fixed. That's why ligamentotomy together with an extender gives results, because a larger part of the penis is able to be pulled out. Not because something magical happens there, but simply because of basic laws of physics. Moreover, the crucial point is that despite ligamentotomy and the extender, there's no assurance of achieving the desired outcomes. But the chances of getting it with surgery and wearing an extender are much higher. The effectiveness of wearing an extender with surgery is about 75% higher than what you would get before the surgery. But again, the most important thing they don't tell you is that you have to agree to this surgery exclusively. Well, I would say understanding that you might not get anything at all. Unlike silicone breast implants where you can request a specific size and receive it, this situation is different. And be careful because an implant can be removed. But many surgical manipulations with the penis are done in one direction, towards one end. And it's very important, why do I get, say, 10 people a month coming to me for the surgery, and out of them I only do it for 1 or 2? In principle, I believe this surgery shouldn't be performed on people with dysmorphophobia. Regardless of the surgical outcome, if a person is fixated, the result won't be satisfactory to them. Even if it's 1.5 or 2 centimeters, he will still be dissatisfied. Dysmorphophobia is when you are unhappy with yourself, and the problem isn't that your penis isn't long enough. There are people who come in with 17 or 18 centimeters, one after another, and it's still not enough for them. No matter what you do, it will never be good enough. That's why I also refer such cases to my colleagues who are either just starting to practice in this field, or are thinking about starting, or not starting, or even quitting. Don't perform this operation on people who have any psychological issues.
You have this ligament, it's there for a reason, it's needed by nature for something. That is, something else functionally, something changes in the body when it's cut.
The angle of erection can vary from person to person. Those who experience changes in erection angle typically have better outcomes. The best results are seen in those whose penis used to stand straight up like a rocket and then starts to stand just a little lower. Forward, you need... Of course, it's a fixing device sex. It's not like we're 75 years old. We haven't been having sex for 70 years. Different positions involve varying degrees of physical intensity, activity, and rhythm. And accordingly, all of this is fixed by the penis. That's why there are also ligaments, there are legs, thanks to which it is held in place. I haven't had that myself, but my dissertation was on penile fracture, and according to the laws of physics, based on the lever principle, the penis always breaks at the base. Most often it happens in the middle third or the lower third according to the lever principle. Accordingly, the longer the lever and the weaker the supporting component of the penis, the greater the chance that something can happen. As the literature says, dislocation. In my practice, I haven't had a single patient who got a dislocation after this surgery. But if you read the literature and modern recommendations, many countries basically don't perform these surgeries because they consider them flawed due to the increased risk of dislocation. Surgical complications are also a factor, particularly for surgeons new to these procedures. There is a downside to these surgeries, which is that the ligaments should not be cut with scissors or a scalpel, but should be properly cauterized. It should be cauterized due to the presence of small vessels and veins, which is safer to prevent bleeding. But when you cauterize, you significantly increase the temperature locally, and this causes trauma to the nerves due to the heat. This is why it's crucial for surgeons to avoid this. I hope you choose a surgeon who follows this practice. By the way, I'm sharing a crucial life hack with you now. This involves irrigating the ligament with cold saline throughout the procedure. The cold saline is prepared before the surgery begins. You check the temperature with your finger, and as soon as you feel that the temperature is rising and it starts to heat up, the assistant should irrigate with cold saline. This minimizes the risk of thermal injury. I don't know if you will share any interesting stories in the comments. Maybe you'll feel shy, but I would really like it if you have something interesting to share, that you definitely do it in the comments under this video. Maybe some stories about who increased by how much, or maybe some new remedy that I haven't mentioned and I don't know about. I will definitely comment on it. So share, right? It will be interesting. To communicate. Violation, sensitivity, yes, that's probably the main thing. Many people experience impaired skin sensitivity, but this is not considered a complication of the surgery. Skin sensitivity is located on the upper surface of the penis shaft near the base. Why is this the case? Because we go in either from below or from above, we simply separate the skin in that area, and that's why skin sensitivity is lost. But it has nothing to do with the innervation of the penis itself, because the innervation of the penis, meaning the sensitivity of the penis and what is responsible for orgasmic function, is in the glans. The glans is what is considered our erogenous zone. And sometimes, if a person has had a bad surgery, sensitivity can be completely lost. That means, in terms of sensitivity, it will be like my desk. Even though the surgery itself, technically, I think, is not complicated, you can mess it up. I once treated a patient who claimed to have erectile dysfunction due to loss of sensitivity in a specific area of his skin. He was from Moldova. No matter how much you try to explain that the problem isn't in that. Get your hormones tested. In the end, I barely managed to convince him to get his hormones tested, and his hormone levels were bad. With those hormones, a normal sex life is impossible. But he became psychologically fixated and started to worry about it. In the end, even his parents approached me, although they mistakenly believed it was a different procedure altogether. When I explained to them what kind of procedure it actually was and that it required hormone treatment, they were like, "Oh, I see." But I found him again, called him myself, and asked, "Did you start taking the hormones I prescribed?" "No, I haven't started." For several months after that, he visited various doctors who gave him nonsensical advice and prescribed many different treatments. In the end... Well, actually, by the way, that was just recently. I prescribed him hormones after all. I hope he will hear me after all. There are often problems that you should also be prepared to face. You won't be able to have sex for a month or a month and a half because you need complete sexual rest. For many, this can lead to congestive prostatitis. Due to the congestion and stagnation, prostatitis can really develop. You should inform your partner about your lack of a sex life, as it's important for them to be aware. Not discussing it can lead to problems. Then the bargaining begins. Sex is not allowed for at least a month after the surgery. It's been 2 weeks, so it's still not permitted, even if it may seem okay. And accordingly, as practice shows, when a person doesn't use something for a long time or doesn't do something for a while. Many people claim that abstaining from sex is the solution to avoiding related problems. Yes, testosterone increases, but it only increases during the first 3 weeks after abstinence, and then, on the contrary, it drops. This occurs in about 5% of patients. I see it in my practice, but it's not reported in medical literature. With prolonged abstinence, hormonal balance changes slightly due to the absence of a sex life for an extended period. But then, that's basically all. recovers. Plus, you also need to understand that there are medical indications. Those of you who are watching us right now, you all think that this is all done on a whim. A person on average has about 14 centimeters, sometimes 13 centimeters, 15 centimeters, 15 centimeters. He just wants to add to what weighs 12. No, but there are people who really have a micropenis, for whom every centimeter is worth its weight in gold, because their penis is 10 centimeters, 9 centimeters. Of course, the weather probably won't add 2 centimeters, but at least it's some improvement for the better. Sometimes, a penis may have a normal size but remain hidden, which is typically treated with surgery during childhood. That is, the penis is straightened, extended, and then at least the person has hope for a normal sex life. Also, you should also remember that often people come in and want to go under the knife, and they want to fix everything at once. Circumcision, straightening, lengthening. Avoid attempting everything at once, as it's not feasible to wear an extender. Don't request this from your surgeon, and if they agree, seek a different surgeon. Don't do all these surgeries simultaneously. The only surgery that can help you with penis enlargement is liposuction, specifically pubic liposuction. If you have a large, thick pubic area, then really removing the fat pad, the hammock of fat in the pubic region, won't enlarge your penis, but it will make it more visible. You'll be able to feel a larger part of your penis. By the way, I often encounter this. My brother and I actually assist each other with some elastic surgeries. People who undergo abdominoplasty, when this apron is removed, they usually have this kind of apron, and most often they also have it on their thighs. Recently we operated on a young man. 6 months ago we removed the apron, and just a month ago we also removed it from his pubic area. He had it so much massive, full and sagging pubic area that on video when you film it visually. If you don't say it's a man, you might think these are a woman's labia, that is, the penis is not fully visible, neither the scrotum nor the penis. All of it is hidden inside the pubic area. There is so much excess tissue, and for some people liposuction will help, but for those with too much tissue, only pubic plastic surgery will help. Pubic plastic surgery is also performed. Because not only 15-year-old teenagers want to enlarge their penis, or 18-year-olds, but also adult men who are 40, 45, 50 years old who have lost a lot of weight or have local fat deposits. Sometimes there's a fat trap due to physiology. Both women and men can have a full pubic area, which may hide the penis in men.
Why is there such a big difference in penis sizes in the world? Like, I don't know, among Africans, among Chinese, it's like 5 times bigger or something, but we're all people, so why is there such a difference?
Well, it's like basketball players, mostly, who are our dark-skinned people, all of them. Well, they are generally bigger, usually have longer limbs, broader clavicles, that's just their physiology. Their skin is also darker, and it's not just the average size of their penis that differs from us. But I can say from surgical experience, how does the penis of a dark-skinned young man differ from that of a light-skinned one? At rest, theirs is larger, but when an erection occurs, it doesn't increase in size as much. As a result, there are many misconceptions about the notion that everyone... There's the belief that all dark-skinned guys have a large penis. Most often, it varies. Maybe for many, it's only 20 to 30%. And for a light-skinned person, let's say, it can sometimes increase 5 or 6 times. That is, the degree to which it increases for some reason is different. So, maybe it's some kind of genetic feature, but to be honest, no one has conducted any scientific research on this topic.
There are all sorts of ointments, pills, and products for enlargement being sold on the internet. What are those?
These are products for increasing the income of certain people, because they don't work. No ointments, no pills, no miracle products. Spells are about the same as if a witch casts a spell on you so that your penis grows. In other words, it's a placebo. But you won't be filing complaints or going anywhere about it.
I've heard about surgeries with implants where they place objects under the skin.
Have you heard? We call them satellites. I first encountered these balls back when I was in residency. It used to be common among inmates. They would bring in prisoners, and most often these things would get infected, become inflamed, and granulomas would form. They didn't just insert balls, they would melt down toothbrushes and insert them themselves in unsanitary conditions. As expected, things don't end well after this, and looked, I've met urologists who practice this. I had to remove it after some of them. By the way, not so long ago, the last patient was from Tula. I don't think it's a very proper practice. I believe it's also just fooling around. Yes, indeed, foreign objects are implanted under the skin, but I don't recommend doing this because, in my opinion, it's not attractive. First of all, it's not attractive. It won't give your partner any new sexual sensations. That's a myth. And I think that over time you'll only get more problems from this than benefits. Dear friends, if you've decided to proceed with this operation, first carefully weigh everything. Approach such an important decision soberly and thoughtfully. Because what makes you a man is not an extra centimeter, not an extra 2 centimeters. Your actions, your thoughts, your life, and a woman also judges you by these things, not by the length of your penis. Almost 95% of patients who come for this surgery do it just for fun. They said, that's why subscribe to our channel for new videos, hit the bell, and we'll see you next time. Hope you enjoyed it. Bye.